Hello, my name is Ian O'Connor. I am a medical student in Charleston, South Carolina, and a member of Students for a National Health Program, which is the student affiliate of Physicians for a National Health Program. We're a nonprofit, nonpartisan organization of doctors, other health professionals, and students, and we support and advocate for a single payer, Medicare for all national health program. But you're asking, do we have time to wait for full on Medicare for all in the midst of this global pandemic? So, we're here today to discuss the emergency coverage proposals, which have recently been introduced into Congress. First, though, we'd like to briefly introduce and give some background on the core policy that we primarily support and advocate. That, of course, would be single payer Medicare for all. So, what exactly do we mean by that? We mean that we want to improve Medicare and expand Medicare. So, to improve Medicare, we would eliminate all financial barriers. That's no deductibles, no copays, no coinsurance, no premiums, truly no out of pocket costs. Also, comprehensive benefits. So, certainly, when a doctor says that something is medically necessary, that would always be covered. But furthermore, we would add coverage for dental, hearing, glasses, etc. Um, then, this improved Medicare, we would expand to all Americans. Um, this indeed would include all members of Congress, for example. We point this out to emphasize that if we're proposing a single health coverage plan for all Americans, that would include every member of Congress, and we know that Congress is going to ensure they have top-notch plans for themselves, and this indeed would be that same plan for all Americans. Now, single payer Medicare for all would eliminate the wasteful overhead inherent to our current profit driven system. And indeed, our status quo multi payer maze masquerading as a health insurance system in America is inexorably inefficient. So, as a quick example, um, about 34% of all spending in the multi-payer private insurance system goes to wasteful administrative overhead. Uh, and that would include, for example, doctors and hospitals have to pay they have to pay staff whose full-time job is to fight with the insurance companies over what is and isn't covered. So a doctor says this needs to be covered, and the insurance company, the private insurance company's entire business model is to deny that. And so the doctors and hospitals have to pay a staff to fight with these insurance companies. And then, likewise, of course, on the other side of the equation, the insurance companies have to pay their staff to perpetuate this fight. Um, that's 34% of spending, 34 cents out of every dollar in the private profit driven system goes into these sham administrative overhead costs. Uh, do we have any calibration for what might be possible on the lower end? Medicare pays only 3 cents, less than 3 cents, in fact, out of every dollar toward administrative overhead. So we do have a system that works that is not only just, but also, in fact, efficient and cost effective for taxpayers. So Medicare for all would also allow the negotiation of drastically lower drug prices for Americans. And this comes from the bargaining power allowed by all Americans being together in a national health program. Um, Crucially, right now, this Medicare for All would move us beyond employer based health insurance. So, as tens of millions of Americans tragically uh, lose employment and their health insurance along with it in the past month or so, uh, we're really seeing is as screamingly, uh, you know, acutely as ever the ridiculousness of the sadly decades long American tradition of tying health insurance coverage to employment. But single payer Medicare for all offers us the opportunity to move beyond employer based health insurance in America finally. So there are two single payer bills in Congress currently. They're similar. Uh, there's one in the House and one in the Senate. And their similarities include the comprehensive coverage we just mentioned. That would be all medically necessary care, um, pandemic and non pandemic. It would include inpatient, outpatient, emergency room, lab tests, etc. It would include prescription drugs. It would include the dentist, audiology, optometrist, full reproductive care, much more. Both bills also include no out-of-pocket costs, as we said. So that's no copays, no deductibles, no premiums. Uh, they would both be publicly funded like national defense. All United States residents would be covered. Um, and it's important we quickly emphasize that that's all residents and not just all U.S. citizens. And this is materially important. Um, the the medical facts are that we all benefit when when our neighbors are healthy. So all of our health is linked and interdependent with our neighbors. This again sadly couldn't be made any more apparent than via the example of infectious disease and in fact global pandemic such as the case with COVID-19. So it really is important that we cover all residents. We need all residents of the United States to be able to get full, adequate medical care when, for instance, they fear they may have coronavirus. Uh, and patients choose their own doctors. So the private insurance multi-payer system that we currently have restricts Americans' choice of doctors and hospitals. Um, the current system is taking away Americans' choice of healthcare providers with these coverage networks that too many are very familiar with. Um, and Medicare for All, both of these bills would finally give full choice of what really matters, of the choice that Americans want and need. It would give full. They would both give full choice uh, of doctor and hospital to all Americans, and prescription drugs again in both bills uh, could be negotiated. Prices could be negotiated way down with the huge bargaining power of a single payer system. Now, these bills are similar. They're not quite identical. So quickly, the differences are the House bill, which is sponsored by Representative Pramila Jayapal of Seattle, with 118 co-sponsors. That's just over half of the majority Democratic caucus in the House. It would put hospitals on global budgets, which would reduce overhead, and it would align services with community need. Uh, this House bill would also include long term care. The Senate bill, which is sponsored by Senator Bernie Sanders with 14 co sponsors, retains Medicare payment models, um, and long term care remains within Medicaid. There would also be drug copays of up to $200 per year. So both of these bills have transition periods, 2 years in the House, 4 years in the Senate bill. Um, and that brings us to the pressing topic of today, which is that multi-year transitions into single payer are inadequate for today's crisis. So thankfully, we do have a couple good bills in Congress. Um, their names are the Healthcare Emergency Guarantee Act and the Medicare Crisis Program and the Worker Health Coverage Protection Act. So from here on, we can more quickly refer to these as the first, second, and third bill, numbers 1, 2, and 3, and also by the names of their sponsors. So, number 1, Healthcare Emergency Guarantee Act, is actually sponsored by both Senator Sanders and Representative Jayapal, whom we just met a couple slide back or so. Now, in this bill, every uninsured United States resident will have all medically necessary care and drugs paid by Medicare. Furthermore, every insured, every American who is already insured will have all cost sharing paid by Medicare. Now, the second bill is again sponsored by Representative Jayapal, but also Representative Joe Kennedy of Massachusetts. And it enrolls only those uninsured who are eligible for unemployment insurance into Medicare Parts A and B, that's physician and hospital coverage. It also expands Medicaid. Now, the third bill, sponsored by Scott and Dingle, is it subsidizes COBRA premiums for laid off workers who had employer based plans prior to the layoff. So if you've been lucky enough not to experience COBRA, it is a system where if you have a job and you have a private health plan through that job and you then lose that job, you can keep that private health plan, and it allows you to keep it by paying the entire price of that private health plan. So that would mean that if you were paying some fraction of the plan's cost while you were employed and your employer was paying the rest of it, that now after your employment you would be required to pay the entire price, both what you were paying and what your employer was paying, to keep that plan. And we know that that is untenable for many, far too many Americans. So this would subsidize those premiums, and it has no provisions for the previously uninsured. So what are the copays, deductibles, premiums? What are the costs of these plans? First plan, Sanders Jayapal, has no cost sharing. That's COVID related and non COVID related for the uninsured. So all uninsured Americans would have no cost sharing. Medicare would pay for all of their medically necessary healthcare costs. For those who do already still have insurance, or for those who already have insurance, Medicare would cover all out-of-pocket costs. Now, in the second bill, the Jayapal Kennedy, there are no premiums, no cost sharing, just for COVID testing and treatment costs, and the enrollees pay deductibles and coinsurance of up to 5% of income for non-COVID care. Additionally, in the second bill, enrollees may buy into Part D drug coverage and Medigap plans to cover non-COVID costs. Now, the third Scott Dingle bill preserves private workplace plans, including their limited provider networks that we discussed earlier. These limited provider networks through which our status quo, profit-driven, multi-payer private insurance system is currently restricting and taking away Americans' choice in healthcare. their choice of doctor, hospital, provider. It also requires copays and deductibles, which for family coverage can be more than $4,000. Now, who's in, who's out of these three bills? Uh, Bill number one, Sanders Jayapal, is any resident of the United States. So, when patients receive care, providers bill Medicare directly for the full cost of treating the uninsured or for the cost sharing portion for those who do have insurance. In the second bill, Jayapal Kennedy, it would be any resident of the United States who is uninsured and eligible for unemployment. So it also would cover household members. And then the third bill, Scott Dingle, is just laid off or furloughed workers who had employer sponsored plans. It excludes businesses with fewer than 20 workers, and there is no coverage for the millions of previously uninsured Americans. What are the durations of these three plans? Bill number one, Sanders Jayapal, is effective immediately, and it stays in effect until an FDA approved COVID-19 vaccine is widely available. Bill number two, Jayapal Kennedy, begins at the enrollee's initial unemployment claim, and it ends when national unemployment rate is within 2% of the 2019 rate. Now, third bill, Scott Dingle, begins March 1st, 2020, and it ends 6 months after the end of the pandemic or no more than 15 months of premium subsidies maximum per worker. Any other features for these three bills? First bill, Sanders Jayapal, does ban surprise billing and the collection of medical debt. It allows Medicare to purchase prescriptions at VA prices, and it prohibits private insurers from increasing copays and deductibles or decreasing coverage for the duration of the COVID-19 crisis. Bill number two, Jayapal Kennedy, increases Medicaid funding. It prohibits cost sharing within Medicaid and CHIP for COVID-19 vaccine and treatment costs, and it requires insurers to cover COVID-19 test and treatment costs without cost sharing or prior authorization. Third bill, Scott Dingle, no additional features. So we believe that these three bills, bill number one, bill number two, bill number three, could fairly be called the good, the modest, and the ugly. So to recap, bill number one, that's Sanders and Jayapal, is the most comprehensive of the three bills. It covers all medically necessary care for all who are uninsured, and it covers all out-of-pocket costs for all Americans who are already insured. PNHP supports this bill. Second bill, that's Jayapal and Kennedy, is modestly helpful, but less robust than the Sanders-Jayapal Healthcare Emergency Guarantee Act. It provides Medicare Parts A and B to any U.S. resident eligible for unemployment and the rest of their household as well. PNHP also supports this bill. The Worker Health Coverage Protection Act, the third bill, Scott and Dingle, pays for COBRA premiums. It subsidizes premiums for furloughed employees. It ignores those who were uninsured before COVID. And indeed, it is simply an indefensible bailout of the private insurance system. So just to quickly reemphasize, this third COBRA bill, it funnels all of this taxpayer money into the inexorably inefficient multi-payer maze profit-driven system that we've discussed earlier. So all those, that 34%, 34 cents out of every dollar of this third bill, this COBRA bill, would go just simply into the sham administrative costs of our private insurance system. The first two bills, in contrast, Sanders Jayapal and Jayapal Kennedy, they would go into Medicare, which we know is drastically smarter, not to mention more humane, uh, cost-effective Medicare system. So that's 34 cents out of every dollar going into administrative overhead in the third COBRA bill versus less than 3 cents out of every dollar going into overhead for the first two bills. Our patients can't wait. Please call your congressional representative at this number, 202-224-3121. Ask them to support the first two new bills. That's the Healthcare Emergency Guarantee Act, sponsored by Senator Sanders and Representative Jayapal, and the Medicare Crisis Program, sponsored by Representative Jayapal and Representative Kennedy. Also, certainly ask them to co-sponsor HR 1384. That's the Medicare for All Act of 2019. Or thank them if they are already a co-sponsor. And you can quickly look up whether your representative is already co-sponsor at congress.gov. Just at the top search bar, type in HR 1384. You can click on it, and then there's a co-sponsors tab with the simple list of all current co-sponsors. So I'd like to really thank all the PNHP staff who put so much into this presentation. And again, we are Physicians for a National Health Program. That's a nonprofit, nonpartisan, member-supported 501c3, and membership is open to everyone. So our website is pnhp.org, social media at PNHP, and Facebook, Doctors for Single Payer. So again, please reach out to your member of Congress, ask them to support these first two bills. That's the Healthcare Emergency Guarantee Act and the Medicare Crisis Program. There they are, both of them again. Please ask them to support these bills. And thank you so much.